Good morning, everyone, and welcome to our LEFF 2 board meeting, November 19th, 2025. It is 9:31, and we will call our meeting to order. Good morning. Oh, you're okay. We will start off by taking a moment of silence to remember our fallen members, as well as those in the military. And I'll give a second for Representative Berquist. All right, we'll take a moment. Thank you very much. All right, looking at the agenda, we have a pretty good one for today. Item number 1 is the approval of minutes, and for just record, it's September and October meeting minutes, and we do have a motion and it's moved and seconded for discussion for the minutes as presented in our packets and also posted. Discussion. All in favor?
Aye.
Opposed? Motion carries. I just got to check. What time's your flight today, Senator Holy? If it leaves at 10:30, okay, I got it. I got you. All right. Item number 2 on the agenda is our DRS Annual update. And we have our Executive Director, Catherine Leathers, here today. Good morning. Great to see you again.
Good morning, everyone. Thank you, Chair Lawson. Members of the board. For the record, my name is Catherine Leathers. I'm the Director of the Department of Retirement Systems. I'm pleased to present the department's annual report to the board today, and I'd like to start by thanking my remarkable team for compiling this information for you. Apologies to the chair. I believe you heard most of this presentation yesterday, but we did add a couple of slides in the deck specific to LEFF 2, so I hope there'll be a little bit of new information for you. In general, I'll be sharing a high-level overview of the department's activities and structure, including some data points that I hope you will find to be of interest. Pensions at a glance. This is related to all of our systems and plans. As most of you know, we have 8 pension systems that include 15 plans across those systems, and DRS administers all of those plans. We also administer the deferred compensation program, and I'll discuss that a little bit later. Considering all 8 pension systems together, including both active and inactive members, DRS serves almost 1 million people in Washington. This means about 1 in 9 Washingtonians has a relationship with the department. You can see the breakdown there on this slide of active versus inactive and annuitants, which is a fancy word for saying retirees or beneficiaries, whoever we're sending a check to, which is actually called a warrant, by the way, which threw me a little bit. When I first got to the department, they're issuing warrants a lot. Yeah, it made me stop and ask. So in fiscal year 2025, which ended June 30th, we collected $5.6 billion from our 1,400 employer partners in contributions, and we paid out about $8.9 billion in benefit payments and contribution refunds. That's across all plans. Our employer partners are absolutely critical to our work, and I have a slide later in the deck that reflects the many different types of employers we work with. I think you might be surprised. Next slide, please. Okay, active and inactive members across all plans. This is just a quick look at how our 15 plans stack up in terms of active and inactive membership. As you know, all Plan 1 plans, or we mostly refer to them as legacy plans, are closed to new members, and they closed in roughly 1977. Next slide. Okay, Plan 1 active members by systems. We've included this slide because we are frequently asked how many Plan 1 members are still actively working in each system. These numbers are accurate as of June the 30th of 2025. Next slide. Deferred Compensation Program, or DCP as we usually refer to it. This is an optional additional savings program that is available to public employees. Since 2017, based on some legislation that was passed, all newly employed state and higher ed employees have been automatically enrolled in DCP at a 3% contribution rate, so 3% of their salary. It's important to note that a person can opt out of DCP at any time. So since 2017, more than 70,000 people have been auto-enrolled in DCP, and 88% of them have stuck with the program. I mentioned you can opt out of DCP anytime. You can also increase or decrease your contribution rate, or you can pause your contribution for whatever period of time you choose. For people who are contributing a percentage of their salary, the average percentage contributed is 4.78% of their salary. For those who prefer to contribute a fixed amount, like myself, frankly, those folks are contributing on average about $777 per month. Next slide. Okay, here's the slide I referenced earlier about our employer partners. It's a really broad list of employers that we work with, from the obvious ones like school districts, state agencies, cities and towns, but really it includes so many different types of employers like mosquito districts, public hospital districts, and PUDs. Next slide. All right, benefits by county. This is all systems, all plans. This slide shows retirement benefits for all plans paid to in-state recipients by county for fiscal year 2025. So in other words, some retirees move out of Washington State, but this slide shows the benefits that are paid to residents of Washington State who are still here. I have a different slide later that addresses just LEOFF 2. Ignoring all the other type of payments that we make, like contribution refunds or annuity payments, and focusing just on benefit payments, we paid nearly $5.9 billion in benefit payments to in-state recipients this last fiscal year. That obviously contributes to our state economy. Next slide. Okay, LEOFF 2 pensions at a quick glance. You can see the breakout of active versus inactive again. You can also see that in fiscal year 2025, we collected $551 million from our employer partners, and we paid out $726 million in pension benefits and contribution refunds to LEOFF 2 members. Next slide. LEOFF 2 benefits by county. This slide shows LEOFF 2 retirement benefits paid to in-state recipients by county for fiscal year 2025. Again, this is good as of June the 30th, 2025. Next slide. I want to talk a little bit about our team members because frankly, they are remarkable. Although we serve nearly 1 million customers, we do all that work with around 300 people. About 40% of our team serve in a more direct customer-facing aspect of our work in the divisions of member experience and member operations. These include the team members who greet you when you walk in the door, team members who answer the phone, calculate benefits, meet with you one-on-one, perform outreach and education. We also have some specialty units that work with members if they become disabled, and others who work with members, survivors, or beneficiaries when a member passes. These are obviously very difficult situations that require a great deal of compassion as well as expertise. So our project management office is entirely focused on our core PAM legacy system replacement project, and I'll discuss that a little bit more later. The Information Services Division supports the existing legacy system, so that's the system that will be replaced by Core PAM. They also provide some assistance to support the Core PAM project. It's also responsible for all of the agency's IT needs, including cybersecurity and fraud prevention measures. The Administrative Services Division primarily supports employers, and it performs all of the fiscal and trust fund accounting functions for the agency. It also includes our facilities team and our legal unit. The legal unit is responsible for rulemaking, responding to public records requests, responding to petitions that challenge agency decisions, and many other legal and compliance-related questions. Next slide. So last month, we presented the annual CEM Benchmarking report to the Select Committee on Pension Policy. And if you caught that presentation, that report actually compares pension systems across the country and includes some pension systems outside of the United States. Among other things, that report determined for all of us that DRS is in a tie for the fourth most complex system in the nation. I have reminded legislators that this is not a competition. We do not want to be the most complex system in the nation. But to that point, I do want you to understand the amount of time it takes to get a newly hired DRS team member trained to the point of being a knowledgeable retirement specialist. You do not just hire someone who is smart and talented and train them in a couple of weeks. We hire retirement specialists in classes, not one at a time, usually between 4 to 14 in a class. And we actually have a class of 6 going through this training right now. These groups spend the first 6 months at DRS in a classroom training program. 6 months, 8 to 5, 5 days a week, where they learn all the basics of our retirement systems. Along the way, their work is reviewed and verified by training team leaders who check and sign off on their progress before they are allowed to move on to the next learning module. After several months, they are eventually allowed to answer basic phone calls and emails from customers, and that is done under close supervision as well. After 6 months in the classroom, the trainees are then assigned to one of 3 units, where they then receive an additional at least 2 months of specialized training. Even after all of that training, it can take years to become truly proficient in our pension system. Appropriate staffing levels matter, especially to our customers, and I think the next couple of slides will demonstrate that. Next slide, please. I appreciate that. So call times, or maybe wait times, if you want to think of it that way. This slide reflects call wait times over a roughly 5-year period from 2021 to 2025. We know this matters to all of our members, and we carefully track average call wait times. On this chart, the vertical bars represent the total number of calls received by DRS each month. That fluctuates between a low of about 12,500 phone calls a month to a high of about 25,000 phone calls a month. So at our peak in the 25,000 a month range, that's a little over 1,200 or about 1,250 phone calls a day. That's in addition to the email communications that we have with members and all the other ways we meet and serve them. The line, as opposed to the vertical bars, but the line represents the average time a caller had to wait before reaching a retirement specialist. You will notice increased call volume in the first quarter of each year. That is primarily driven by calls related to federal income tax questions. I know. Call volumes were also elevated even more in 2023 and 2024 because of special one-time payments for LEOFF retirees. That led to additional calls about the payments in 2023 and then about the tax reporting requirements in 2024. So I am happy to report that DRS has seen average call hold times come down and stabilize with the additional staffing that DRS has added over the past few years. With support from the legislature, we were able to hire and train these new team members, which obviously takes some time, as I've explained, but that has all resulted in shorter hold times. The funding provided by the legislature to hire more retirement specialists made a measurable difference, and we are grateful for their support. Our goal is to bring down average wait times to under 2 minutes. We haven't quite met that goal yet, but we are approaching it. We're at 2 minutes and 2 seconds. We will get there. Next slide. Okay, this next slide shows average days. Oops, I'll wait, sorry. All right, this next slide shows average days to complete benefit estimates over the same 5-year period, 2021 to 2025. It further demonstrates how impactful it was for the legislature to support our request to hire additional retirement specialists. As most of you know, the first step in the retirement application process is creating benefit estimates for the soon-to-be retiree. The bars in this chart show the number of benefit estimates created in a month, with a high of around 4,000 and a low of around 1,000. The busiest time for this work is in the spring, as employees of school districts approach retirement later in the summer. The line represents the average time from request of the estimate to completion, with a high of around 50 days. That's not good. Once again, largely because of the increased staffing, the average time to completion has been reduced to at or under 10 days. Next slide. So we're doing all the things we're supposed to do, but we're also doing some other things in the background that you might not be aware of, like working to enhance security, replace our 35-year-old legacy system, and update our strategic plan. Next slide. So starting with security, as part of a recent agency budget request, we contracted with LexisNexis to provide enhanced security features for our online customer portal. The goal of the project is to make online account access more secure for our customers. The project was scheduled to be completed this year, and I am very happy to report that the project has been completed. The LexisNexis system now delivers live event risk data, and it automatically blocks high-risk events. Our cybersecurity and risk management teams will continually refine this system, and LexisNexis will report system performance to agency leadership quarterly. The other updates were made, but I won't go into it at this meeting unless someone has questions. Next slide. Okay, we've been talking about this a lot, and we're going to continue to talk about this very large IT project we call Core PAM until it's completed. So CORE stands for Creating an Outstanding Retirement Experience, which is what we intend to do by empowering our team members with this new technology. And PAM, as you can see, stands for Pension Administration Modernization. And because a picture really is truly worth 1,000 words, I wanted to quickly show you what our current technology looks like and what we work with on a regular basis. So the top right-hand corner of this slide is literally a snapshot of the system that we're using. And I don't know if any of you remember war games from the early 1980s with Matthew Broderick. Well, that's about the same system. This technology was deployed in 1992. Most of our newest hires weren't even born then. So while the system has served us for nearly 35 years, it is time for it to retire, pun intended. In fact, most of the DRS team members who actually built this system and have maintained it over the years, they have either already retired themselves or they're about to retire. We just started year 3 of this transformation project. And while projects like these are incredibly hard, our remarkable team is working tirelessly to remain on time and to meet all of our scope and functionality expectations. We plan to go live with this around September of 2027. And as a reminder, our system must also interface with One Washington, which is an external factor that we do not control. While this system is not customer facing, we think our customers will notice and appreciate some of the improvements when we do go live in 2027. For example, We've designed a member self-service option for getting an official DRS benefit estimate. Currently, we have tools in place that allow customers to calculate an unofficial estimate. Then they have to come to us and ask for an official one. It takes a lot longer. With this new technology, most customers will be able to get that estimate through our website and they can apply to retire immediately. So that will be, I think, a very much appreciated improvement. We also think that this new technology will decrease the amount of time that it takes us to actually hire retirement specialists and train them, because it will automate so many of the things that they're doing manually right now. So just a quick note on the budget for those of you who are interested. This project was under budget. Let me repeat that. This project was under budget last biennium and is projecting a similar savings this year. We hope to obtain the necessary support to move those savings into our last biennium for the 2027 budget so that we can finish the project. Finally, we also plan, just as a heads up, we also plan on making a budget request for the 2027-2029 budget biennial budget to move to the next phase of this project. And that will hopefully replace our customer and employer online portals and improve them. We are currently in the process of completing a feasibility study for both of those proposals. So more to come on this next year. All right, last but not least, I know I've been talking a lot. Strategic planning. Thank you. I do think that part of our job is to constantly think about how we can improve the way we serve our customers and work with our partners. So our agency is at a critical juncture. We are on the verge of implementing transformational business and technology modernizations that will change both what we do and how we do it. So this does present us with an opportunity to develop a fresh, forward-thinking strategic plan. Our approach has been data-driven, collaborative, and inclusive of diverse voices. We first focused on listening to our customers, team members, partners, stakeholders, and we did that through various means: surveys, one-on-one interviews, and focus group discussions. Thank you very much to everyone who shared their thoughts and input on what we're doing well and what we could do better, including you, Chair Lawson. Thank you. We learned that the vast majority of our customers and partners are very satisfied with our services. While most of the feedback was positive, they also shared with us some opportunities for improvement. For example, we received mixed reviews about our customers' digital experience. They like the tools they have, but they would like to see more tools and resources. This is an issue we hope to work on after our core PAM project is complete, so post 2027. We also heard that members would like more retirement-related resources and people to talk to about financial preparation. Some members voiced support for permanent COLAs for those legacy plans that don't currently have a COLA, and others want more flexibility to change their Plan 3 contribution rates. Employers were also appreciative of our support, but they'd like to see more employer training opportunities and improvements to the tools they use. I don't have time to address all the feedback that we received, but please know this: we heard from all of you that wanted to share your thoughts, and we heard you. And we will take all of your input into account. We're using that to inspire us, and we look forward to sharing our updated strategic plan with you in 2026. Next slide. All right, that concludes my presentation on behalf of the Department of Future Happiness. And if you have any questions, please feel free to ask them now. I will try to answer them, but I'm pretty sure I told you everything I know.
Are there questions? Senator Holy, go ahead.
Thank you, Mr. Chair. Catherine, it's a joy to actually have the exec director come here and present in person on this and put themselves in the line of fire with this motley crew. I'm amazed because you say there's 6 active left one members out there. Every one of those cops has to be 70 years old or older. I mean, it's non sequitur at this point. I've been on the board a long time, and some people say that's institutional memory. Other people say that, I'm way past my pull date on a lot of my information. Long time ago, we actually used to have a dedicated left to specialist. And the closest thing we have anymore is Seth, obviously institutional memory, but we are kind of a unique system in benefit structure, and because every time we tamper with something, on the board here and it comes to fruition, we distance ourselves farther and farther, from the mainstream out there. Is there any chance that you would have a specialist again assigned to the left system, so that we'd have the ability to have a go-to person rather than just cycling through people that might not have the same institutional background that Seth does, for example?
We can certainly look into that, Senator Holy. I appreciate the question. And I have noticed that in the training program, the training is on the general rule, and then there's the LEOFF exception. And it's pretty consistently true. So I understand why you would ask that question. And let me see what we can do. But for now, please continue to contact Seth Miller. Thank you.
Other questions? Not seeing anyone.
All right. Thank you so much. I appreciate it.
Thank you very much for
It
your
was a
time.
pleasure.
Yeah, great to see you. All right. Item number 3 on our list is the CEM benchmarking. Jacob?
Yeah, so introduce Marcus Erlander, the Budget and Performance Management Director from DRS, but we've had a chance, he's actually been working with the Left 2 board for a few years before taking on his new role. He's actually replacing Mark Feldhausen, who's been coming in front of the board for a long time now. But Marcus was the, I forget the exact title at OFM, but our budget and policy contact at OFM. And I guess he just enjoyed pensions so much, he wanted to commit himself full-time to pensions. So it's great to have him still working with us. And then he's bringing up Seth Miller as well, who everyone's familiar with.
Okay, there we go.
Thank you. Good morning, Chair and members of the Left 2 board. My name is Marcus Erlander. Jacob just gave part of my introduction there. Appreciate it. Director of Budget and Performance Management with the Department of Retirement Systems, and I'm here with my colleague Seth Miller, who I know you all.
Yeah.
As Jacob mentioned, I know many of you will recall Mark's presentations on this topic, and we did provide a similar presentation last month to the Select Committee on Pension Policy. This is a similar presentation. In talking with Karen and some colleagues beforehand, sort of talked about the difference in interests between perhaps this board and the Select Committee, and the interest in, to some extent, maybe a more focused interest in the metrics that relate to the services that we provide. Right. So we have similar, but we have added a slide in there, and Seth is going to focus on that topic, on the metrics part of this. So as Jacob mentioned, I worked at OFM before coming here. I worked with Mark for about 4 years in that role, and also with Karen and Steve and with the Left 2 board. Talking with Mark about this really did give me an appreciation for this process, for the CEM process, this benchmarking process that I think you're generally familiar with. From the OFM perspective, you see a lot of sort of standardization. Right? There's a lot of information that is intended to be the same for all the state agencies so that you can try to compare and come to a common picture. And sometimes you look at it and you say, is this really relevant for this agency? And it's like, well, we all have to do it. But for this CEM process in particular, you really see, here's where we are focused on the metrics and the information that's really relevant to DRS. This is really tailored to a pension administrator. And so you really get a comparison that's relevant to the work that we do. So I know at DRS, people really do take these metrics seriously. It's a great resource for us because it lets you see by comparison to other states, to other pension systems, and get a sense for the choices that we're making, how we're investing the resources that the state provides, and sort of the difference that has in the service that we achieve. So I appreciate the chance to talk with you today with Seth. hopefully won't go on too long here with its presentation. Let's see. So do I click the button? I do. Okay. I have to get to terms with this. If I just click, will that do it? Down arrow. As in rolling it, or if I can just click there. Okay, that'll work. All right. Thank you. So up on the screen here, we have just an introductory slide. We have a couple of introductory slides here on the CEM benchmarking process. As you can see, this is a very broad survey. The company is based in Canada, and they include many different systems. 38 from the United States. We have Canada, we have Netherlands, we have the United Kingdom. So it really is a broad set of information that's used for comparison here. Within that, we have then a peer group. So you might think comparing us to the Netherlands might have some utility, but it might, be hard to compare in a lot of respects. So we do have a peer group. And when you talk about the metrics that they score us on, it really is comparing us to this peer group. And you can see up on the screen, we have just some basic information about that peer group, where you see we're sitting there in the middle in terms of the general size. You can see it lists there the active members, the annuitants, and the total numbers. You can look at the ratios there, and Catherine mentioned the difference between the open systems and the closed systems, and you can sort of get a sense for that here in terms of how many active members and annuitants you have in that system. This slide here is a new one that we added. Much of this that we're showing is from Mark's work that he left, the prior presentation that he's given. This is a new slide. We talked about some of the feedback that people have received on this process, and I think one of the interests is always sort of getting a sense of the scope. What are we really talking about here when we talk about these performance metrics? Maybe less so here, because I think you might be more dialed into the performance and sort of what that means. But from the funding perspective, people who focus on the pension system are interested in the total cost of benefits being provided. What are the contribution rates, the billions of dollars that you see in the state budget? What we've identified here is this is really what we're talking about, which is the funding for the Department of Retirement Systems in particular, that 0.2% administrative fee that gets applied to employer contributions. And just to sort of dial in on that scope, we're showing here what it's been over the last couple of decades, where you can see that it has fluctuated. It's been fairly stable. At the end there, Catherine talked about the Core Pension Administration Modernization Project. You can see there that because of that project, and a big chunk of our budget right now is due to that project, it has the effect that our administrative fee has increased in the last couple of years. And so it just gives a sense there. This is the part, this is the funding. When we talk about the scores that were received and the value that we're getting for the investment, this is the funding that we're really talking about here. So with that, I will turn it over to Seth. I appreciate having him here. Since I am new in this role, I think it's nice Seth can speak with a lot more authority on the services that we provide and what these metrics tell us. So I'll turn it over to Seth here for the next couple of slides.
Pat.
Before we leave, when you're talking 0.2%, and that's 20 basis points over annually, correct?
Mm-hmm.
And it's at 20%. It's at 20 basis points because we're modernizing our systems right now. If we weren't doing that, it'd drop us another couple, probably another 5 basis points down, correct?
Yeah, I think absolutely. It's hard to say exactly how that impacts on a year by year basis.
Okay.
Yes.
I'm bringing it up because I've seen a lot of these slides before, and I just want to make sure that we and if there's anybody listening that and I'm probably getting ahead of you guys, but I'm going to do it anyways, is that the cost that's being charged for our system is relatively low compared to anybody else's that's our size, and that's due to the modernization and everything that you guys do at DRS. So just go ahead.
I appreciate, and we are going to get to that. You've seen this deck 10 times before, which I appreciate. And we'll share. I don't want to speak for Marcus. I wouldn't say 5 basis points. I might say 2, but we'll, yeah, that's,
I'm sorry, but should you sit here for the?
oh, I don't really want to be on camera, but yeah, I can, yeah.
We were asked to switch, so sorry. about
Okay,
that.
no problem.
We know who you are. It's okay.
Well, I'm sure the tens of people on TVW are really excited to see my face as well. Yeah, so once again, for the record, Seth Miller, Department of Retirement Systems. I think most of you know me, but I know there are many people who are new to this board or newer. So I first want to just give you a refresher about how these charts work. These are produced by CEM, and as Marcus mentioned, they compare us to our peer group of large US systems. And so what we're looking at on these charts, the dark blue bar is always going to be DRS. And then the light blue bars will be our peers. And then the lightest shade color is everyone else that is in the US system. So Catherine stole our thunder with this slide, but this shows the complexity as determined by CEM, and the DRS currently shows as the 4th most complex. To Senator Holey's point, I do want to just say almost all pension systems are almost all the same. You know, there's a multiplier, 2%, years of service, average salary, but then every pension system is slightly different on how they calculate those, what sort of timeframes they look at. One of the beautiful things about working with CEM is that we get to pick brains of other retirement systems and learn what some of the complexities are and the uniquenesses are. And I was thinking about this before because I didn't want to make Mitch's head explode from an actuarial perspective, but we heard about another pension system. So in Washington, our folks who retire can choose between 3 different survivorship options. They can choose a 100% survivorship option, a 2/3 survivorship option, or a 50% survivorship option. We heard about another state. You can choose whatever percentage you want. So if you want to choose 23% survivorship option, you get to choose that. Well, maybe I want to choose 84%. I just thought the actuaries would love to do that calculation for us on everyone that retires. So I'm not well, I was say I know this was the wrong place to make that suggestion or make that comment. I'm gonna kick myself for that. Well, and Jacob will get to do 3 presentations on it too, so we'll all be excited about that as well. So this is our complexity slide. I've got 3 other comparison slides from the CEM presentation that I'll walk you through, and then 1 background slide as well. So Catherine also stole a little bit of our thunder here, but this is our service score in comparison to our peers. DRS is right near the median, right near the average. The service score is made up of a lot of different factors, but the primary driver is really how quickly we answer our phone calls. And we have seen improvement, though at the start of this presentation, you might not have caught. This was really for last fiscal year. We're expecting to see this service score continue to improve on the next report, which we are just in the process of submitting our data to CEM. And we hope to continue to see improvement. One of the other nice things about working with CEM over the last number of decades, you'll see the little table on the bottom there. We're able to compare how our service has, compare how all of these factors have changed over time. And you'll see, especially in the early days of COVID, our service score did drop a little bit. Some of this was staffing related. Some of it was increased call volume as well. And then Marcus mentioned we added a new slide, and I know that you all like to dive deep into the data. This isn't something that is part of our CEM report. This is something that DRS actually tracks quarterly. And Catherine mentioned our overall staffing. This is staffing just for the front part of our agency, the member experience and member operations divisions. And we track over time what our overall staffing levels are, and then the staffing in the different job classifications. And as Catherine mentioned, you'll see, ideally this will look a little bit like a sawtooth wave. You'll see it increase when we hire a new class, and then it will slowly drop over time as we have attrition throughout the divisions, and then we'll hire another class, it'll spike back up. And so you'll see those spikes are every time we hire a new class. And starting in late 2022 and into 2023, when we were given additional authority for hiring larger classes and more retirement specialists, you'll see that trend line come up. And we've now stabilized at what our staffing will be hopefully going forward. Just two more slides from me, and then I'll turn it back to Marcus. This to the earlier question about how we are comparing against our peers in terms of overall cost. And so what this is taking into consideration is our cost per member. So per active member and annuitant, DRS, we cost $91 per person who's in our plan. And you'll see we are quite low in comparison to our peers. The blue bar there, the dark blue bar, being kind of in the bottom quartile or definitely in the bottom half of overall cost in comparison to our peers. This is a newer chart for CEM, and it was exactly to Pat's point, is that they added this pinkish color on the top of each bar to show how much of our overall spend is related to major projects. And the vast majority of our major projects are around the replacement of our IT systems. The thing I would also point out, though, if you look at all of our peers, they also have pink bars above there. They are also doing major IT replacements. What you'll hear, and I'll talk a little bit more about this on the next slide, every pension system either has just replaced their IT system, they're in the process of replacing their IT system, or they're about to replace their IT system. But the chart on the right takes out if you don't consider the overall major project costs. So we go from $91 per member to $65 per member. So it's like we anticipated Pat's question, or Pat anticipated our presentation, I think is more likely. Last chart. This is a new chart from CEM, so none of you, well, unless you watched the select committee last month, none of you have seen this presentation, seen this chart specifically, but this shows the age of the computer systems that all of our peers are using as well. And you'll notice DRS is quite far to the right. Generally speaking, though, lots of systems have systems that are 20 plus years old and are in the process of needing to replace. And even once you have I'm sure all of you know this in your day jobs, with technology, it's always getting updated. There's always a need to stay relatively modern and current with technology. So even, and as Catherine mentioned, we're going to be replacing our underlying back-end technology, but the next step is to replace the customer-facing portion of the technology as well. And then we'll continue to refresh and make those modernization efforts. I'm going to pause because I'm about to turn it back over to Marcus to see if there's any questions on what I presented.
Questions? I had one regarding the sawtooth and the transition of new employees, people exiting. When people leave, I mean, do you go through a process, an evaluation, find out why they're leaving? I mean, age, or are there people just transitioning to other roles?
Yeah. So if you want to dive deeper, we do have that information as well. So we track if it's internal promotions, which is oftentimes the member facing part of the agency often feeds the rest of the agency. So Catherine mentioned our IT group, our project management group. Many or most of those folks came from the customer facing part of the agency. But yeah, we also do track retirements. And one of the things that we do when we're looking at staffing is when we're looking to hire our next class of people, we're looking at not just the pending retirements or vacancies within our part of the agency, we're looking at the rest of the agency as well, because we know there's going to be dominoes that flow. If there's we have an employer support unit that helps employers answer phone calls, get the data into our system. We know if there's a vacancy in that part of the agency, it's probably going to impact the customer facing part of the agency. There's going to be a promotion that happens. So we do track that. We've also done exit interviews with folks to try to understand why people are leaving, if there's things we can do to improve, and then do surveys of active team members as well to ensure.
Thank you.
Yeah. All right, I'll turn it back over to Marcus. Let him get back on camera.
Okay. Well, thank you, Seth. So here we're just stepping back up a level to look at it sort of from the highest level. In terms of those numbers, we saw in the charts that Seth showed the cost comparison and what we're getting for the money that we're spending, what we're getting for the investment. This is again on the same question that we've touched on. I think it really highlights that distinction between the business as usual costs as opposed to those project related costs, and sort of trying to tease those out. So in this chart, there's a few things going on. The teal at the bottom in the bars really shows that that consistency in the overall spend, and you can really equate that, the value that you see there, you can equate that to the administrative percent that we charge to some extent. There is some lag in that because we don't necessarily change it right at the second that we notice that we can. We know employers like to have some consistency in the rates, so there's some consistency in there by intention historically. But you see there then the orange part of the bar again reflects the major project costs where you see that fluctuation. And then again, as Seth noted, we see the overall picture in our peer groups where you notice that they have that increase, and a lot of that is due to them also being involved in these kinds of major projects. Okay, got to scroll. Oh gosh. Pardon me. There it is. Okay, sorry about that. So, okay, so this is a new slide here, or it's a variation on what we had. But basically, when you looked at the difference between us and our peers, you saw that there's a $42 difference in the total cost. And so it's interesting to see what can we attribute that difference to. And that's really where the CEM data I think is valuable internally, because it's not just the total picture of how much you're spending. Really, it gets into a great deal of detail on what is building into those costs. And you see here that $42, this is directly what CEM reports to us. They split it out and they say, okay, of that 42, we can say that $10 of that difference is a difference in overall FTE costs, salaries, benefits, other costs of FTEs. The two middle ones there are related to front office costs, where you have the FTE count, just have fewer front office FTEs than the average. They attribute $16 to that. $5 they attribute to other front office costs. $11 is other administrative areas. So there's a lot more detail than that in the report in terms of where the differences lie, but you can see there how it's spread out, how it splits out. And with that, just an overall summary again, appreciate the chance to share this information with you. We're benchmarked against other administrators in North America. That's the peer group that we referred to. What this data really gives us is a large sample size, a lot of information about other similar systems, so that we're not just going by gut instinct. We're really getting data so that we want to be data driven in our decisions and in our analysis. DRS administers a very complex group of public pension plans. As you've heard, we provide a solid level of service at a very low cost compared to our peers. And when you look at fluctuation, the largest influence on changes is in our total cost per member is the current ongoing major projects. And that covers our presentation. If you have any questions at this time, happy to address them.
Any questions? All right, not seeing any. Thank you very much. Appreciate your time today.
All right, thank you.
Item number 4 on our list is the standby pay. It's a comprehensive follow-up, and that is going to be presented by Jacob White. Jacob's going to be going back and forth, so.
Okay, for the record, Jacob White, staff to the board. In front of the board, first up today on the policy topics, standby pay. And this is a follow-up report to last year. The board last heard this issue in December, where you received a pricing on it, but decided to not move forward with it last session. Reason, or part of the reason for that, was due to the data that had been gathered and the pricing that had been completed by the actuary's office with the limited amount of data and some concerns about the data. The actuaries were able to provide a pricing range, but the board wanted to gather additional data and have this topic come back this interim. So issue in front of the board is that standby pay is not considered basic salary for LEF 2 members, while it is for PERS and PSERS members. And there was a question when we last discussed this topic, when it was put on the agenda, about whether there were other, for PERS and PSERS, were there other types of pay that they did not get counted as basic salary that LEF 2 didn't. And so had a chance to review that and did not come across any that fell into that category. So standby pay conditions. So typical standby pay conditions, present at specified location for a specific time frame, or immediately available to be contacted, prepared to report immediately for work if the need arises. Because of that, you must not be impaired. And the pay depends on the contract for those employees, but it is less than full pay. And I'll come back around to these standby pay conditions because they came up as I continued to gather data. So this is just a reminder of the data that was gathered last year. Had to do this through public records request because there is not a single source that I could go to get this data. It's not reported to Department of Retirement Systems or anyone else. Yeah, I did a kind of sent out public records requests all across the state, got back data. Some of that data was not usable after working with the actuaries on it, and so this was the data that was usable. Also just wanted to put the pricing, as I said at the beginning, the actuaries were able to do a pricing range given the limited amount of data. And so they had that at a potential rate impact between 0 and 4 basis points. So since last year, I continued to send out public records requests and communicate with public records officers around the state, and was able to gather additional data from these employers. Some of these are much larger than the employers that I previously gathered data from, especially King County, which had around 1,000 members. And I should say I don't have a nice chart breaking down those costs because still I've provided this data to the actuaries, but they have not had time yet to do a pricing and go through that data and ensure that it is going to be usable. So in gathering this data, I mentioned that King County was the largest employer that I heard back from. A new issue came to my attention. So when I had made these requests, I had asked for standby pay and given some description of what I meant by standby pay. Heard back from employers, wasn't really questioning whether I got everything back. And then it was brought to my attention by a member that some employers have types of pay that meet all those earlier requirements of standby pay. All those restrictions that someone's on and how they're paid, but it's called something else. And so it was especially confusing, surprising with King County because they had a type of pay called standby pay that they first provided. And then I had someone, an officer from King County, let me know that they were asking about an update on this. And they shared with me the amount of what they considered standby pay that they had received in the last year. And it was actually more than all of what had been reported to me by King County as standby pay. So they were around 25,000 just by themselves in what was, as I dug into it, weekend on-call duty pay. And so I did a follow-up records request or data request to King County. They provided me the weekend on-call duty pay, which was significantly larger. It was unclear whether other employers had types of pay like this as well. So I sent out follow-up public records requests. I have back from many of the employers, not all of them yet, but most of them have got back to me that they do not have any additional data. Nothing like weekend on-call duty pay or some similar type of name pay that they didn't already provide to me in my initial request. And then in continuing to talk to the actuary's office about the data, I did want to just highlight that there are other data concerns. It's still going to be, not going to be able to gather all the data from all the employers and all the members to get a perfect pricing. So it's still, while I've, at least doubled the amount of data or the number of employers that we have data from, it is still a relatively small number of employers that we were able to get data from. And like I said, the actuaries have not been able to do a data pricing. But in early talks to them, I believe they'll still have to do a range pricing instead of being able to clearly identify a pricing on it at this point. And the data is another year older. When I gathered new data, I tied it to the time frame of the previous data, so I wouldn't have to regather everything. But now we're a couple of years along, and the data is getting older and may not be as accurate with changes in that we've learned about from previous actuary studies that have been presented as far as demographic and experience studies and changes in LEOFF members. So in front of the board today would really one policy option, add standby pay to definition of basic salary. The pros are that this would align LEOFF 2 with the other state pension plans. The cons are there would be an increased cost to the plan. And then, like I said, there are data concerns. Once again, at this point, the actuaries have not reviewed that data and provided an updated pricing. So don't have a full picture at this point of what concerns the actuaries will have once they have a chance to dive into that. So in front of the board today, possible board action. The board can motion for a final briefing in December where they would be able to receive that pricing from the actuaries. You could motion to direct staff to gather new data, to obtain a more complete estimate, and provide a follow-up presentation next year. Or the board could choose to take no action at this time. If there's any questions, I'd be happy to answer them. Thank you.
Questions? Go ahead, Jay.
Thank you, Mr. Chair. So I'm not surprised, Jacob, that getting data on this particular one was troubling, mainly because I think when you think about labor contracts, depending on what city and how you address it, each labor contract may address the issue of standby, or whether they call it standby, they could call it something else. They could just agree that if you're on standby, you're just getting paid for a day, and that's how they treat it. So I think this is a difficult one for you to get a definitive answer on. However, my initial thought on this is pay. And if you're getting paid for something that is related to doing your job, it should count towards your final average compensation. That's how I see it. Pay is pay. But I think we should continue to see all the rest of the data and get it priced out so we have all the information in front of us. But just my initial thoughts, that's kind of where I land on this.
Appreciate it. Senator Holy.
Well, thank you, Mr. Chair. Jay, you bring up a thought here. We are going to affect CBAs out there for the several agencies on that. It's an additional cost that wasn't anticipated as part of the total compensation package here for the employer's contributions on this. Should this become, part of a final average salary for that purpose? I mean, is that problematic? And I'm asking you to extrapolate for most of the people out there.
Well, to me, I think it's just about consistency, and because there's a lack of consistency in terms of how cities probably apply this, I think we'd have to do a little more homework to figure out what the impact is on individual cities, because I think some cities don't call it standby pay in their contract, so it's already being counted as part of their salary. So I don't.
Those type of waters, that trail that was lost to build. There's one piece of property adjacent to the North property that.
Hey, Bud, you're on mute.
Hey, Bud, I think somebody.
Oh.
Got it.
So I don't know if this is a big issue or a little issue overall.
Pat.
Jay's, we discussed this at length in the administration, and I agree with Jay all the way. As an employer on how we do it, and coming from a different organization, standby pay may have been already calculated to regular salary, and they've been paying all of the benefits and for years. So, and it's, if you're tasked not to be able to go to your children's games during the weekend, during the week, you're not allowed to go to parties, birthday parties and stuff like that where there's alcohol being consumed, and you're more than a half an hour out, and you're being told, I'll give you this amount of money to give up these benefits. That is work, and it should be compensated for in that. So we talked about whether we should put this off or move it forward. I like what Jake, and let's get the information as much as we can and consider it pay. I don't think it's going to hurt the pension that much. We have to pay 30%. The state, of course, is in issues, and then they're going to they have a dog in a fight also. And whether that's a large dog or a small dog is what we'd have to get to through the legislature. And of course, with the way the budget is right now, this may not be the right time, but I think it's a time that we need to bring it up. And if it's in PERS and PSERS, it doesn't make sense why it's out. I can come up with my conclusions because when this was first put together, it was left one and left one. The only thing they considered in left one was basic salary. No educational incentives, no other standby pays were ever considered for pension contributions. And it was just glossed over and saying it was just a blanket. No, they don't get it. But now we've created PERS and PSERS, especially PSERS is the newest pension that came out, and they gave it to them. So it makes sense to level the playing field and have it go for left two also. So I'm with Jay made some great comments on to define what we were talking about earlier today. So thank you.
Chris?
Thank you, Mr. Chair. I'll try to be brief. I mean, I think the points are really well made.
Sorry.
It is. Okay. The points are really well made. It's really a fairness issue. At some point, I think when you've tied employees to the policies and procedures of the department on their off-duty time, you're controlling their time. And whether or not it's fully on the clock or whether it's on a standby on-call basis, those ties to that officer's or that firefighter's time, it's really important that that is treated consistently across all the employers. And I think the fact that there is sort of inconsistency or there's a way to creatively contract around that issue, I think giving employers some consistency, giving the employees the certainty that that tie to their lives is compensated as some kind of compensable, pensionable income is really important to have that sort of, that issue resolved. And then fair across all the pension systems in the state of Washington. So I think this is a really important recruiting and retention tool for law enforcement especially. I'm sure it is within the fire service as well. And I really appreciate that we've taken up this issue, and I would definitely be leaning towards one on this possible board action.
We've had some great comments. Representative Berquist.
Thanks, Des. I think I'd just like to make a motion for option one, final briefing in December.
Thank you very much. A motion been made and seconded for option number one, which is the motion for final briefing in December. Any other discussion? Go ahead.
Thanks, Mr. Chair. I think it would be great to get a little more understanding on that cost, given our budget situation we're looking at. So if we do get a better idea, I think that'll help paint a picture for next steps at our December meeting.
Sounds good. Thank you. Other comments? Anything online? Not seeing any. All right. All those in favor of the motion, which is to number one, motion for a final briefing in December, please say aye.
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 Opposed? Motion carries. Thank you very much. Appreciate that. Item number 5 on the list is the duty disability health insurance, the comprehensive follow-up. Jacob? You're there.
Okay, for the record, Jacob White, staff to the board. The issue, and okay, once again, this is a comprehensive follow-up to a report the board received last year. So the board received 2 briefings on this issue last year and then decided to not move forward with it. It was in front of the board again, is a possible topic this interim. And so this is the first presentation this year on this topic. So there we go. As a reminder, the issue is that members who separate due to a duty disability only have temporary access to employer-provided health insurance through COBRA. And I should add, we're talking not catastrophic disability, but duty disability. And just some background, this issue came to the board as a letter from WACOP's request, and it had to do with a specific member, and that member issue was resolved. So I'll go into more detail as I move forward here. So just want to walk through the possible steps for a member who ends up in a situation that would be covered by this. So you have an employee who's injured at work and unable to return to duty immediately. They go on temporary duty disability. After temporary duty disability, they can either duty disability retire through LEOFF 2. They can continue to be out on authorized leave of absence while they continue to try to recover and return to work, or the employer may terminate employment. And that was part of the issue that came to the board last year. And so that someone could be terminated from employment, not continue to have healthcare insurance while they're still attempting to recover from their workplace injury. So if the member duty disability retires under LEOFF 2, they retain a right to return to their position, that position is protected for them to return to once they've recovered. So temporary duty disability, when someone's out on that, they qualify for L&I benefits. They're covered for medical care related to their injury under L&I benefits. For LEOFF 2 benefits, they are able, not really what's at issue here, but did just want to touch on, they are able to purchase service credit for that time period they are out on temporary duty disability. And then there is disability leave supplement. And so this is not a LEOFF 2 benefit, but it was a benefit that the board looked at last year when researching this. So what is a disability leave supplement? So the employee must receive the base salary they would have received before their injury. They continue to be covered by their employer health insurance, and the law requires it for, it's phrased as a maximum of 6 months. But there are agreements with some employers and their employees that the employer may offer additional coverage outside of this law. And then after temporary duty disability, so after that 6 months or longer once you're beyond that, if the temporary duty disability is exhausted and the member has not recovered, I touched on these before, but just to reiterate them, there could be out on authorized leave of absence. The employer can terminate, or they can have the option to duty disability retire. They could also catastrophic disability retire. I think people often don't think of either of those as being potentially temporary, but they are. For catastrophic, you have to meet the requirements of catastrophic for at least a year, or it's believed you will meet them for at least a year to qualify for that. And duty disability does not have that same time frame. So it is a way for members who are injured, who may be terminated because they're not able to return to work, to retire, have some income from that, and a guarantee of being able to come back to that position. However, duty disability does not have health insurance reimbursement. So I just said that, but so yeah, duty disability, no LEOFF 2 health insurance premium, would still be eligible for COBRA health insurance, but that is a temporary benefit. How long people can have COBRA depends on the situation, but typically it's at least a year. And then catastrophic, for that, if the members are reimbursed for their premiums paid for health insurance up to the amount of COBRA. And then what happens when a member returns from duty disability? The law requires that the member may choose to return to their previous position at same salary and rank previously held. The employer is required to rehire. Last year I did check with DRS to see how prevalent this was. It had only happened 4 times, but some members at least had taken advantage of this option.
Jay, can I ask a question on this?
Yeah.
So if a person has a duty or catastrophic disability, they actually retire then? So meaning, are they on pension then? Just trying to make sure.
Yes, they are.
So they're drawing pension.
Yep.
They go back to work.
Yes.
During that time they're on pension, they have a break in service.
Yes.
If they were towards the end of their career to get to the FAS, 60 consecutive highest months, usually it's towards the end of the career. If somebody has that break, that would go back to a previous time frame, probably be the time frame that they were on pension before.
Yes, the time period where they were receiving a pension would not count towards their final average salary, but yeah, the rest of it would.
Okay, so make sure I had it right.
Yeah.
So,
And then we did talk about VEBA a bit last year. It's just, we did touch on a couple other areas where someone might have, be able to pay for or qualify for some sort of health medical insurance coverage. However, yeah, VEBA for lots of members, especially younger members who are injured and find themselves in a situation, probably not going to cover much of their medical expenses. And then also did touch on the Washington State Council of Firefighters medical expense reimbursement plan as an option for firefighters to save for medical expenses, and that it did allow an option for members who are disabled to receive a reduced benefit, to be eligible for that benefit earlier. So in summary, duty disability retirement allows members to temporarily retire until they've recovered from their injuries and provides those members with return rights to their position and salary. However, duty disability does not provide them with medical insurance premiums reimbursement. So with that, the policy option in front of the board is to reimburse duty disability health insurance premiums through LEOFF 2. Pros with that would be that it aligns catastrophic disability benefit with duty disability benefit, and then obviously covers members in situations like the one described. The cons would be an increased cost to the plan, and that the duty disability benefit was really designed for members who are still able to work in non-LEOFF jobs where they could have access to employer-provided health insurance through those other jobs that they're still able to do. And so next steps for the board would be the board may motion to receive a final briefing, and the board may not take any action at this time. If there's any questions, I'd be happy to answer them.
questions or direction?
Mr. Chair, I move item, next step is item number 2. No further action. I think we have enough that we've dealt with.
Okay. Is there a second?
I'll second.
Motion's been made and seconded for number 2, which is no further action at this time. Discussion? Seeing none, all those in favor say aye.
Aye.
Opposed? Motion carries. All right, thank you very much. Jacob, next one on your list. Surviving spouse medical reimbursement, comprehensive report.
Thank you. Last time, for the record, Jacob White, staff to the board. This one is not a follow-up to last year. This is a new topic that the board last heard about in July, I believe. We've dealt with a few of these issues this interim that are involving some of the same groups of members. So just to refresh you on this one, there are gaps and inconsistencies in medical insurance premiums or premium reimbursements for surviving spouses of line of duty death. And so I think when I last presented this in July, we just highlighted one of those issues, but since then additional issues have been brought to the board's attention, one through a letter that the board received, which I'll get into a later slide. So before I start this, I wanted to just try to highlight the differences between survivor of line of duty death benefits and catastrophic disability retiree benefits. Because I'm going to come back to this, do my best to keep it clear and as simple as possible. So survivor of line of duty death, and I should start with that can be someone who dies while on duty or it can be someone who retires, including catastrophic disability retirees, duty disability retirees, or just regular service retirees, and their death is later found to have been a line of duty death. It can be then converted to their survivor can be converted to a survivor of line of duty death. So survivor of line of duty death, eligible for PEB through, they're eligible for PEB. They're reimbursed by LEOFF for their PEB premiums. They are not reimbursed by LEOFF for other medical insurance premiums, including Medicare. For catastrophic disability retirees, they are not eligible for PEB unless their employer was in PEB. They're reimbursed by LEOFF for the following premiums: their employer-provided insurance, COBRA, Medicare Part A and B, and then if they're no longer able to be under their employer-provided insurance, they can seek other medical insurance, but the amount of that cannot exceed the amount they'd be eligible for under COBRA. And I'd love to be able to provide you that amount of what it is for COBRA, but that depends on the employer, and DRS has a whole process of having to go to the individual employer to get that amount. I'll try to touch on it a bit of kind of a range later in the presentation. Okay. So the first issue, the one that was in front of the board in July on this, this came from a letter to the board from a surviving spouse. So as LEOFF gets older as a plan, we have more surviving spouses of line of duty death who are becoming Medicare eligible. PEB requires, and not just for survivors, but anyone in PEB, that once you're Medicare eligible, you have to enroll in Medicare, and they require that because there are significant savings to the PEB plan when you reach that. The issue becomes that the LEOFF law does not include reimbursement for Medicare premiums. It's very specific, that is for PEB reimbursement. And so once someone is forced to now have to enroll in Medicare to continue to be in PEB, they are no longer, and the cost of being in PEB drops for LEOFF to reimburse. The member is on the hook for those Medicare premiums that they now have to pay instead of being reimbursed through LEOFF. So to give you some idea of the cost, I have a range here of what PEB cost LEOFF members, and these are based off some reimbursement data I got from DRS of what they're currently reimbursing LEOFF survivors. So pre-Medicare, it was a range between about $800 to $950. When the survivor enrolls in Medicare, that drops to $150 to $180 per member. And then to give you an idea, the Medicare Part B reimbursement is about $185 per month currently. So there are currently 30 survivors enrolled in Medicare. And we discussed this back in July, but there still would be a cost to the plan. So that for that additional Medicare reimbursement that currently isn't done, but it is, I think, significant to show that the overall cost to LEOFF for reimbursing members, once they're Medicare eligible, there is this drop from the pre-Medicare cost to the Medicare eligible cost. And then I did get an average this came from OSA of what it's not exact, but it is to try to get at what the cost of COBRA would be, that the catastrophic retiree average, I'd say I'm overcomplicated. I'm gonna get back to that. Sorry, that's gonna overcomplicate this. I'm gonna skip that. I'll get back to it. I'll leave it at that. Okay, so issue 2, surviving spouses are limited to PEB. So this didn't come up directly through the letters the board received, but it is an issue that's been brought to board staff's attention over the years, that when there's a line of duty death, a member now is eligible for PEB if they want to be reimbursed for their medical coverage, but they can't get reimbursed if they remain on their employer coverage or other medical coverage. And this has come to our attention because it's another thing that a surviving spouse and family have to deal with that can cause additional stress, that they've just had the member, their spouse, die, and now they might have to change medical providers and deal with that while they deal with all the other issues going on. And this also, I should go back to this, also can impact catastrophic disability survivors who they've continued to be eligible for their employer provided health insurance, or they've gone on to another health insurance. And so they end up in the same situation. It's not just people who are killed in the line of killed while on duty. It can also be line of duty deaths that occur after retirement. Yeah, and this is where I meant to touch on the cost of COBRA. So survivors of line of duty death can only receive medical insurance for PEB if they had the option, like catastrophic does, to remain on their employer coverage up to the amount of COBRA that would cost more than PEB on average. And then this was another issue related to this that came to the board through a letter, which is included in your materials. It is, there can be a gap in insurance reimbursements. So when a member dies, they have their surviving spouse has to go through a process of having that death determined to be in the line of duty. That process is not immediate. And sometimes it can stretch out for over a year or longer if they have to go through an appeals process with LNI, or there are other issues with applying for the benefit. Sometimes this can be that the member is not aware of the benefit and doesn't apply for it immediately. But the board received a letter from a member who had, it had taken more than a year from the time of death to the determination that it was in the line of duty. There was over $22,000 in COBRA premiums they had paid, and they wanted to be reimbursed for those, felt they should be reimbursed for those premiums. One of the reasons they're not eligible for those reimbursements is that they are, once again, they're only eligible for PEB reimbursements. You're only eligible for PEB once your death has been determined to be line of duty. And so the member was not eligible to join PEB. They can't be reimbursed for PEB. They can only be reimbursed from PEB for once they're actually, receiving it. So people find themselves in this, it's kind of this gap in coverage. And I should add, I checked with DRS. They did not have a data source. They could look them up one by one, but there was not a data source for how long it is between the death and that determination from LNI. I spoke with someone over at LNI, and they believe they're going to be able to get me that data, and they're working on it. So I would hope to have that if this moves forward before the next board meeting. So the options in front of the board, I'm going to go back over, I'll try to make it quick, back over these three options, and then there would be for board action, the board would be able to move forward on any or all of those three issues that I've just got done highlighting. So the first is to option one would be reimburse surviving spouses of line of duty death for Medicare premiums. Pros of this: continue to recognize the sacrifice of left two members by continuing to provide full medical insurance reimbursements for their survivors. Overall cost of the plan is less than when they are only in PEB. But the con is there would be a cost because currently they're not being reimbursed for Medicare, and this would have them reimbursed for Medicare coverage. Option two, provide surviving spouses of line of duty death the option to enroll in PEB or continue to have the same medical insurance premium reimbursement options as catastrophic disability retirees. And I worded that one that way because I didn't want to list out as you saw, there was a list on an earlier slide of all the different catastrophic disability reimbursements that they're eligible for. So it would just align those two benefits. The pros is this creates the option to prioritize continuity in medical provider coverage for survivors. Cons are there would be a cost to the plan. And it creates another decision point for members, and that can cause confusion. It can cause regret. Because it would likely need to be a one-time decision that someone needs to make, and they may, at that point in time, want to just keep on the coverage they're used to, and then could later learn, well, maybe I should have switched to PEB. So, there could be administrative issues that prop up like that later on. And then option 3 would be to reimburse surviving spouses of line of duty death for medical insurance premiums paid during the delays in a member death being determined line of duty. So the pros are, I believe this meets the policy goal of paying medical insurance premiums for surviving spouses and their families. It prevents survivors for being penalized, which I believe was the language that had been used for administrative delays that may be out of their control. However, once again, the cons are is there is a cost to providing this benefit. If this moves forward, there would be an option that this would be a retroactive benefit to cover the member who wrote the letter in and potentially other members who found themselves in that situation. So next steps would be to motion for a final briefing on options 1, 2, and or 3, or to take no further action at this time. If there's any questions, I'd be happy to answer them.
Questions and direction. Senator Holy.
Well, thank you, Mr. Chair. Jacob, well presented on this. I'm right to the point with the options. Although we're trying not to do this. Okay, let's just say under the category of, I can't remember what I had for dinner last night. I believe in 2006, I was a board member that actually made the motion for this to go forward to present to the legislature. I'm trying to delicately ask. We might have a mere shadow of a former executive director sitting in the audience and make a pro forma appearance here and talk about, if you remember, what the not just what our intent was, but what the legislative intent was at the time here. And is this being applied properly? And is there potential for an administrative solution and clarification, or does this require legislation?
So
Who are you?
my name is, for the record, Steve Nelson, staff to the board for another 4 months. So Senator, you touched on a point. One of the reasons for the inconsistencies that Jacob described is that these benefits have developed over time. At the time, the very first benefit was the line of duty death benefit with medical in PEB. And that was the reasons why PEB was chosen had to do with cost certainty. The legislature knew what PEB cost, and so it was easier to price the bill, if you will. What ended up coming out of that, though, was some of these other unexpected issues. And again, the surviving spouses are grateful to have coverage as opposed to be reimbursed, but they did have to change providers. And for some of them, it's like, oh, I'd spent years finding the right dentist for my kid, and now I've got to, in addition to everything else, I've got to go out and find new providers. Then came catastrophic, and one of the things we found out during the administration, the development of the implementation of the line of duty death bill, catastrophic came a couple of years later. The Social Security issue, it's like, well, you know, the bill says reimbursement for PEB, and Medicare's not really PEB. So when the catastrophic bill was written, there was a reason why the language in that bill was much more specific, because we'd already identified issues out of the implementation of the line of duty death bill where there were coverage that wasn't going to be included. The other issue that came out of that is healthcare authority. Particularly when catastrophic disability came out, they said, we don't want any more people in PEB. If you write the bill to put catastrophic disability retirees into PEB, we're going to oppose it. And so the bill, and by that time, maybe there was more understanding about what is the cost of all these different providers that you guys have out across the state, and how different really is that from PEB, and how important is that difference financially, given that this doesn't impact, we have like on average 3 line of duty deaths per year and maybe a dozen or a little bit more catastrophic disability retirements. So the amount, even if it was, yeah, we'll reimburse your employer medical, and that could be more expensive. We're talking about a couple $100 more expensive for maybe a dozen members. Ultimately, that cost issue that came up in the development of the line of duty death bill turned out to be not as significant as originally thought. And so, yeah, the pricing on all three of these, the Medicare premiums, $185 a month for 30 people. You're going to see the total price from the actuary's office, but given the fact that these benefit changes are in the grand scheme of things fairly modest and they apply to a very limited number of people, I think the pricing will be modest in December. But that timing of how those came about, Senator, is the answer to your question, as there was more experience with the different plans out there and the cost of the different plans. And particularly when the first bill was being written, medical premium inflation was running 20% a year. And so there was a lot of concern over potential costs back in 2006 that are have now that stabilized in 2025. I hope that answers your question.
Go ahead, Senator.
It does. So correct me if I'm wrong. After Renee Marr presented, I said something that probably haven't heard a lot over the last 20 years here. I just said very, very few times I'll say this, but cost be damned, this is a moral imperative. And I think it still exists as a moral imperative to provide exactly what we promised, what we intended, originally with this. And it's such a small number of people that are so dramatically affected I'd make a motion to move forward on this.
Motion made for number one, just for clarifications, motion for all three of them to move forward?
Let me clarify on that. Steve, if we were to pick one that's closest to our original intent from the options, which one would most closely mirror what we tried to do 20 years ago?
I would probably say, I'd probably say all three of them. The Medicare piece we addressed when we did the catastrophic, because that was an unintentional oversight. So even though it wasn't in the line of duty death bill, it was clearly intended to be covered. Similarly, the reimbursement of when it takes time to make the determination, that was addressed in the catastrophic bill. That was another something about the original line of duty death bill that wasn't really understood. How that the timing of the L&I process could affect that benefit. This proposal is sort of taking all of those lessons learned that were applied in the catastrophic disability bill and applying them now to the original line of duty death bill. If I was very high level summarizing the net effect of these three.
So, Mr. Chair.
Go ahead.
Just for an explanation right off. So, Mr. Nelson, right?
Yes.
You're an attorney?
I recently
So you were
resigned my membership from the bar.
So you were asked to pick one of the three and you picked all three?
Yes.
Perfect.
Just wanted to make sure that I heard an attorney opinion.
Perfect.
So,
That's what I like. Senator Holy, back to you just for clarification.
If I can get a second, maybe we could discuss this a little bit, Pat.
Yeah. Second.
Right.
Okay, so
Continue.
we have a motion. I'm going to, based upon what Director Nelson just said, that all three were important. all three were part of maybe in his mind, the legislative intent, or what they believe the legislative intent was, the board intent when they were introducing and moving things forward. So I would say 1, 2, and 3 would be moving forward for a final briefing if that's appropriate. Okay.
Is that your motion, Senator?
Motion stands.
So all three of them.
Yep.
And I get, so, and then we'll be able to pick and choose from one of those three, right? Okay, because one of the things, the presentation that I saw was, one of the things is when somebody passes, there's a lot of grief with the survivors and stuff like that, and trying to pick, you know, which insurance company you go to or disability. It's another problem for them. And if all of a sudden, number 3, you know, you go into this and you're covered. So I'm good with, I'm okay with everything. I thought that number 3 would have been the best pick, but I'll support all 3 of them too.
I did want to jump in and tell you that I'll be able to work with the actuaries to price. Usually when I give you options, it's like this or this, and these are all 3 related to each other, but they're not necessarily different options. But I'll be able to work with the actuaries to price each of these components of this. And so if one component ends up, you know, costing a lot more, or there's, you know, you decide you want to not do
I'm
that.
not really worried about the cost.
Okay.
I think what we're trying to do is make sure that the survivors are taken care of. Right? That's what,
Amen.
okay.
Representative Berquist or Chris, I'm not sure. I'm sorry. Apologize. Representative Berquist.
I wanted to make sure I understood maybe in the following briefing, how this would align or not align us with like the State Patrol or other programs, and if there is a goal to, you know, move everyone forward if there's a motion on this, or if it's just within this plan.
I would have to come back to you next month with a breakdown of State Patrol. They have a very different disability benefit than the other plans. PCERS pretty newly has a catastrophic disability benefit that's based on LEOFF 2, so it's probably very similar. I could come back with that in December.
I guess I just wanted to make sure that we're taking that into account. If we're going to do something here, we don't want to, you know, I think it'd be good to work with everyone if there's opportunity there.
Correct. Chris.
And again, I'll try to be brief again. To Senator Holy's comment about moral imperative, I just wanted to just say that I don't think you could talk to a single participant in the plan who wouldn't want to make sure that this group of our survivor families are provided for, and to close these loopholes to make sure that there aren't unfair treatment of the people that have dealt with the most catastrophic issues impacting our professions. I think we all want to make sure that they're taken care of. Thank you.
Thanks, Chris. Jay?
Yeah, I'll just add that I'm glad that all 3 of these are moving forward for final briefing. I guess I don't see these as, hey, pick one of these 3. I see them as 3 different issues that all need to be addressed versus one solving everything. So I see them as interrelated and needing discussion kind of individually versus, hey, which one is the one that best fixes it? Does that make sense? I just think they're 3 distinctly different issues that survivors are dealing with that need our attention.
Yeah. Okay. All right. So before us, we had a motion which included items 1, 2, and 3. It's been seconded. So before you, all in favor, say aye.
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 Opposed? Motion carries. Thank you very much. Appreciate that. Jacob, nice job. So next up on our list is the number 7, 2026 board calendar adoption. That has been included in your packet. It was presented at our October meeting, and Boy, are you going to go over that? It's not. No, Lord, no, we don't do that anymore. Not yet. Yeah. You give her 10 minutes and a laminator. She's good. That thing's already warmed up back there.
Just ready for approval.
That's right.
Good morning, Chair Lawson and members of the board. For the record, my name is Chloe Drosby, staff to the board. At the October, I'm sorry. Let me get you up here. I should have looked at the presentation here. Thank you, Jess. Weird delay, so you gotta kind of wait on it. I'm just gonna go through here. Yeah, like there. Okay, perfect. Thank you, Jess. I apologize. Okay, at the October meeting, you were presented the proposed 2026 board meeting dates. Today, you have the opportunity to adopt the final dates, assuming there are no other conflicts. There was a conflict with the April 29th meeting, so it now has been changed to April 15th. The proposed dates are in your materials and also on your screen. Once you've adopted the final dates, I will send Outlook invites for the year. And of course, if anybody wants them, provide laminated copies. And then that is everything. If we're ready to vote, I will let you do that. And then if there's any conflicts, we can always adopt later if need be.
All right, before us right now is the adoption of the 2026 board meeting calendar as presented. Discussion or direction? Jay?
Thank you, Mr. Chair. I hate to be the, last minute, but this is not a conflict for me. I just want to raise it that in May, we have a meeting that is a long weekend. I know some people do plan time away around long weekends. And so it's fine for me. And if no one else has a conflict, I think we can leave it as is. But, if we could move it to the 20th, it might give people more flexibility in terms of how they take time off.
I note on the schedule that we have NCPERS, the ACE conference.
The same time. So it works for me. I just wanted to raise it in case anyone didn't see it, but it's fine for me. I'm not suggesting we change it. I just wanted to raise it before we vote.
Appreciate that. Other comments? Consideration? All right. What's your pleasure? Anybody? Bueller? Motion's been made. Is there a second to adopt? Second. Motion's been made and seconded to adopt the 2026 board meetings calendar as presented. Discussion. Seeing none, all those in favor say aye.
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 Opposed? Calendar's adopted. Laminate away.
Thank you so much.
All right. Boy, Jacob, number 8. The admin update.
I just have to say, I've enjoyed that we had 2 80s movie references today. We had War Games first, and then you bring Ferris Bueller, and I'm feeling left out here. To bring my A game next month.
Yeah. Thermonuclear war. Go ahead, buddy.
Okay, admin update. Okay, so agency updates. The state auditor's office will present the 2024 financial audit report at the December board meeting. Some outreach updates in let me see, October 23rd to 24th was the Washington Fire Commissioner Association Eye to Eye Expo. Tim and Jessica provided outreach at that event. And then on November 6th, the Washington State Council of Firefighter Cancer Support Network had a meeting in Ellensburg that Tammy presented at, and Jessica attended with her. And then at the IFEPB annual conference, Tim did a presentation there. And then I did also just want to provide a quick update that on the tribal legislation that was passed now a couple of years ago and that the board studied 4 or 5 years ago, that is continuing to move forward, and that I did participate in some meetings with tribal leaders, including police chiefs, and the governor's office and the governor's office of Indian Affairs. So there continues to be interest in that, and it is continued to move forward, and I will provide updates in the future as that moves forward. And that's all for today.
All right. Thank you very much. Any questions for Jacob or Director Nelson? Seeing none. All right. Number 9 on the list is the public comment, and in highlighted yellow is the left 2 board welcomes public comment in advance of all meetings and has posted instructions on its website for submission of written comments. Staff has received comments from a known name individual, and we're not able to verify whether the member is actually a member of the left 2 system, but the comments were posted or shared with you in your packets, and they regard rising premium cost, and you can read those. So we thank people for their comments. We appreciate if they would actually identify their name and where they worked, and maybe we can help them out. So we got. Any other questions? All right, seeing none. It's that time of the meeting. You 2 fast guys, go ahead.
Move to adjourn.
Okay. Motion's been made and seconded to adjourn. All in favor, say aye. Opposed?
We don't get food?
You get food, yeah. I know Berg was like, he's gonna die over there. He was ready to eat at 9:45. Yeah, plus food, yes. All right. We'll see everybody in December.